which means that they'll have some stuff on it to make them look pale, so you can see that, but yet you still can't feel cool and clammy, so you'll have to ask about skin color, temperature, texture, and they'll tell you. But they may have open wounds on them. Do not become distracted by that. We're still going to go right through the scenario, and I'll tell you what to do about that as we go. So when it comes time, all we have to do is just verbalize. I'd have a partner put direct pressure on that and dress it and stabilize or splint it, and it's done. So you can verbalize that in just a fraction of a second and not worry about that. So don't get messed up in tunnel vision and thrown off by these visual cues that they're going to be giving you. Ecchymosis, same kind of thing. If it's on an extremity, you're going to assume that it's fractured. You're going to have somebody stabilize that and put a splint on it. That's all you got to say. All right? Any questions along those lines? All right. So when you come in, they're going to introduce themselves to you. Make sure they get your name and your letter number onto the thing, and take a peek around. Make sure that the station is set up with something that's very similar to what you see here. So you have a blanket to remind you to cover, because that's a critical criteria. Who's my critical criteria guy? So he's going to be looking for things. So treatment of shock with the oxygen and the OPA and the blanket over there are just imperative stuff. That's why we want you to have those out when you practice. So you get the visuals. You don't have to even touch them, but you need to do them. You need to verbalize them. All right? All right, otherwise there's a whole host of the critical criteria, aren't there, sir?
Yes, sir.
Yeah, there's a whole host of those that are contained in these 5 fingers that you guys have been training yourselves to hold up and go through. All right, so here we go. They'll tell you whatever the scenario is, auto pedestrian or whatever, and you're ready to begin. So first thing you do is hold that hand up and go through the 5 steps. Number 1 is scene safe. Number 2, myself and all partners have BSI precautions taken. Number 3 is how many patients do I have? Do I need any additional resources? They'll tell you you just have the 1, and I'll ask for an MOI, NOI. Is there any kind of nature of illness? They'll say no. Mechanism of injury then, and they'll tell you is a whatever it is, auto pedestrian in this case. And so my general impression then is my 5th one. Given that this patient's laying out and having been hit by a car, I'm going to call that a high priority trauma patient, which means that it's a load and go situation. And I'm ready to begin. So I'd have a partner hold the head in an inline and neutral position and maintain that throughout. Hello, sir. Hello. How are you? No response. Wince. I'd have my partner do a jaw thrust and open the mouth. I'm going to look in there and sucker pluck PRN. Look, listen, and feel. And they'll tell you he's breathing, rapid and shallow. All right, I would have a partner apply an OPA and 15 liters of oxygen by non-rebreather mask. And I'm going to open up his chest here. Do I see anything on the chest? Negative at this time. If I did, I'd take care of it. Then auscultate. Asking the evaluator, what do I hear in the terms of lung sounds? Clear and equal bilaterally. Good. All right, so airway and breathing are taken care of. Let's do circulation now. And skin, color, temperature, texture. Pulse is present, yes. Radial pulse is absent or weak, yes. Carotid is a little stronger, yes. All right, so let's go ahead and strip him down naked and do a blood sweep. I'll say, I see an open wound here. What kind of bleeding do I see? They'll say it's steady venous bleeding. I'll have a partner put direct pressure and a pressure dressing on that to control the hemorrhage and split it whenever we can. Any other bleeding? Don't see any. He's trauma naked. I'll go ahead and cover him to preserve body heat. And then I want to clear an arm for vital signs. I'll have a set of vital signs to include a pulse ox, blood pressure, pulse, respirations, and capnography. I'll also ask for a spine board, straps, C-collar, head immobilizer, and a cot. I'm now ready to begin my rapid head to toe. Looking for decap BTLS throughout. The scalp, behind the ears, in the ears, behind that ear, in the ear. Facial bones, check the pupils for size and reactivity to light. Nose, in the nose. Facial bones again. OPA is already in place. Do I see anything that needs to be sucker plucked now? I'll tell you no. Palpating the C-spine and back of the neck muscles. Jugular venous, the stitching are flat. Take the trachea in my fingers like this and walk it straight down. See if it's midline. It is. See if there's any medical alert tags around this necklace. There aren't. Walking the shoulder girdle and clavicles over. I'll have a partner apply C-collar now. Check the chest. Check for symmetry of movement. I'll inspect the abdomen. Do I see any ecchymosis? We'll say there's ecchymosis in the left lower quadrant, so I'm going to palpate it last. Looking for any grimace or signs of trauma, and he grimaces with that. All right, I'll cover that top half up and observe this bottom half. Do I see any asymmetry? Down on the pelvis, in on the pelvis, stable. Look at the genitalia. Checking for symmetry of color or temperature. All the way down this extremity. Shoes and socks would be off all the way to the toes. Pulse, movement sensation, capillary refill, medical alert tag. Same thing here. I've already got this leg bleeding controlled. I'm going to go ahead and assess that leg anyway. Pulse, motor sensory, cap refill, medical alert tag. I'll go ahead and have a splint applied to that. Now I'm going to look at and cover that up. I'm going to look at the arms. Are they symmetrical in size, color, and temperature? And then we'll palpate them. Pulse, motor sensory, cap refill, medical alert tags. Pulse, motor sensory, cap refill, medical alert tags. C-collar is on. Someone is stabilizing that leg is with log roll. As a unit, person at the head, 1, 2, 3. Expose the backside and inspect. Palpate those parts where I couldn't palpate a while ago. All the way down to his coccyx, scapula, posterior ribs, flanks, looking at the rectum, backs of the legs, and back down on 3, 1, 2, 3. I'll have my partners package the patient and try to gain a sample history. As soon as we can get out of here, we'll transport. En route, we'll do a ongoing assessment, which is repeat vital sign, repeat the initial assessment, and check on interventions, and we'll do a detailed physical exam if time permits. All right. You had the critical criteria.
Yes, sir.